endodontic treatment, because irrigation is the only thing that will reach every single canal of these accessory canals. Not every single one, but let's say most of them, and will disinfect them and clean the area. So that the irrigation is very important because of this thing, which are the accessory and ramifications, accessory canals and ramifications that are present in our root canal system. Until now I was talking about the normal pulp condition. Now we will go to the diseased pulp condition, and the first one, which is the reversible condition, which is the reversible pulpitis. This one differs from the first one almost in nothing. Clinically it is the same, radiographically it is the same, anatomically it is the same. Histologically they differ. There are some inflammatory cells and blah blah blah, but I hate histology, so that I didn't want to include so many pictures about histology. Anyways, but clinically the symptoms are a little bit different. There we have said that there will be a mild to moderate pain on the hot or cold stimuli. Here there will be a severe, not mild, pain on the hot and cold stimuli, and this is the case where we should indicate that there is a pulpal disease. Okay, so that if there is a severe pain on a stimulus that subsides after the removal of that stimulus, which means there is no spontaneous pain, no continuous pain, that means we have reversible pulpitis. The third condition, which is the irreversible pulpitis, which, as we can see here anatomically, the pulp has bruises, has contusions. Guys, do you see this? Pulp is not completely white as the normal pulp or the pulp with the reversible pulpitis. This pulp with irreversible pulpitis has contusions. Do you see them? On the coronal part of this, I think, central pulp, central incisor pulp, so that this thing is the thing that we will see it in the irreversible pulpitis cases, and this is the thing that might possibly need a pulpotomy procedure, because we can remove the coronal part, which has the irreversible pulpitis thing, and leave the radicular pulp and do a pulpotomy procedure. And this is the irreversible pulpitis clinically. It will be characterized by a non-stoppable bleeding, and this is the irreversible pulpitis radiographically. As we have said before, that the pulp is not visible on the radiograph because it is not a hard tissue, but we will see the consequences, so that either there will be no radiographical changes, or there will be a mild widening of the PDL space that will indicate to an irreversible pulpitis condition. So that the irreversible pulpitis is a pulpitis that is characterized by the presence of a spontaneous pain, or if we apply a stimulus, it will be a continuous pain that will linger after the removal of the stimulus. And the final condition that we have is the pulp death or pulpal necrosis, which, as we can see here anatomically, is a rotted thing, and if we see it clinically, we will see that there is no redness, no bleeding, nothing at all. This will indicate to a necrotic pulp. And if we can see it radiographically, again, it is not visible, but the consequences might be either no change, or a mild widening of the PDL space, or widening of the PDL space and a periapical lesion. All of these things will indicate to a possibility of the presence of a necrotic pulp. So that the pulp necrosis, it could be partial or complete, because guys, there is a possibility that the coronal pulp is dead but the radicular pulp is still living with irreversible pulpitis or reversible pulpitis. But is it possible to have a partial pulp necrosis? Yes, it is possible, and in this case we will have a spontaneous and continuous pain, indicating that a part of the pulp is still living and having this sensation of spontaneous and continuous pain. But if the tooth is completely dead and has a complete necrosis, in this case the patient will feel nothing and there will be no symptoms at all, because the tooth is dead, so that obviously he will feel nothing. So that the summary of the pulpal diseases. We have known the etiology of the pulpal diseases, and we have known that there is a possibility of the presence of other than pulpitis as a pulpal disease. But until this moment, we have the pulpitis as the most common pulpal disease, and the other conditions of the pulp, which are, we have the normal pulp with a mild pain, and the reversible pulpitis with a severe pain, and both of them have not are not spontaneous pains and not continuous pains. And the treatment of these cases is the removal of the stimulus. Okay. The irreversible pulpitis is characterized by the presence of a spontaneous pain or a continuous pain that lingers after the removal of the stimulus. The treatment of this type of pulpitis is by a pulpotomy procedure, an endodontic treatment, or an extraction of that tooth. The last case or condition that we have in our pulps are pulpitis, which are either partial and have spontaneous and continuous pains, or complete, which will have no symptoms at all. The treatment of this case is only an endodontic treatment or extraction procedure. Guys, the Wheeler's Dental Anatomy, Physiology and Occlusion is the greatest dental anatomy book that I have read so far. But I wonder, why didn't they include this great picture in it? Anatomy means a gross picture of the thing, and our teeth are composed. Half of our tooth is a hard tissue, and the other half of our tooth is a soft tissue. And in Wheelers, we can only see the hard tissue, but we cannot see a picture of a soft tissue. And this is not fair. It's like we are studying a Gray's Anatomy or Grant's or any anatomy book, and the whole book is talking about the bones without mentioning the muscles, the nervous tissues, or the blood vessels, which is impossible, because every anatomy book like Gray's Anatomy, Grant's, or Netter's, or any anatomy book will mention the soft tissue part and the hard tissue part of our bodies in a gross picture. So that I wonder why this is happening in Wheelers, and from this stage I highly recommend the authors and the editors to include the gross picture of the soft tissue part of our teeth in this great book. Always try to know always try to spread knowledge and always try to construct the world. Be kind to others, and that is for the greatest benefit to the humankind.